CS or natural birth? Which do you prefer? Before you make your choice, I'm here to tell you the advantages and disadvantages of both. That is why you need to be informed. That's why I'm here to tell you about which one is more convenient for you before you make your choice. If this is a topic you are interested in, please watch this video to the very end so that you can learn and decide for yourself which one you prefer. Please subscribe to my channel so that YouTube can be able to recommend this video and will be able to bring you more content from this channel. Cesarean section, popularly known as CS, is a surgical incision made into the abdomen and into the womb of a woman to deliver a baby. Yes, that is CS. Then we have two types basically, which is the elective and then the emergency. The elective CS is when you decide or you book an appointment with your doctor that on this particular day, I want my baby to be delivered, basically through cesarean section. But the emergency one is when, let's say, during the process of labor, you become tired, your baby is stressed, or the baby becomes bigger than your pelvis and all that. Then we quickly rush you to the theater for a cesarean section. That is the emergency one. Those are the two types of cesarean section that we have. Now let's look at the advantages and then the disadvantages of CS before you make your choice. Okay, so the first advantage of cesarean section, there is a reduced risk of birth trauma. In cases whereby vaginal delivery poses a risk to both the mother and the baby, please, you might go in for cesarean section. Okay, situation in which the baby's head is bigger than the mother's pelvis, or the mother's pelvis is smaller than the baby. We call it cephalopelvic disproportion. In this situation, please don't try vaginal delivery. You might just hurt yourself and hurt your baby as well. So this particular case is strictly cesarean section. No two ways about that. So that is the very first instance in which someone should go in for a CS. So the second one, prevention of complications. Okay, situations whereby a woman is delivering and gets so exhausted and she's not able to push anymore. The baby becomes so stressed, or the baby is very, very big. In that situation also, CS is preferred. Please don't make a mistake in this particular situation to deliver on your own. Either your baby dies or you die. Okay, so in this particular situation also, CS is mostly preferred. It's an advantage for you to go in for CS in this particular case. The third advantage is in cases of maternal health conditions. If the woman has health conditions whereby she cannot push, or when she delivers through the vagina, the baby may get blind, the baby may get infection or any other disease, you go in for CS. Situations of HIV/AIDS, okay, a woman who has HIV is advised to go for cesarean section, else you transmit the HIV to the baby during the process of your vaginal delivery. But if it's through CS, your baby is very, very much safe. And then another situation whereby a woman is having an infection called herpes simplex virus or syphilis. In this particular cases, if you deliver through the vagina, your baby will go blind. Yes, so it's much advisable you go in for CS in these cases as well. Unlike those days whereby cesarean section was very deadly and then scary, it's not the same now. This age is very, very safe for you to have a CS. And then in situations where you have a twin, a triplet, quadruplet, please, you can't do that through vaginal delivery. Yes, you may hurt yourself and you may hurt your kids. So in case you have a twin pregnancy or multiple pregnancy, it's preferred you go in for a cesarean section as well. So those are some of the advantages of cesarean section. Now let's come to the disadvantages. The first disadvantage of cesarean section is longer period of healing. Yes, you don't heal fast when it comes to cesarean section, because remember, there are a lot of tissues that were cut during the process of bringing your baby out. So all these tissues have to heal one after the other. So it's going to take a long period for you to recover from cesarean section compared to vaginal delivery. Okay, you have a longer period recovering. The second disadvantage of cesarean section is delayed breastfeeding and bonding. Okay, after cesarean section, you are going to go into recovery. Yes, you need to recover first, and your baby is not going to breastfeed until you are fit enough to handle that baby on your own, leading to delayed bonding with your child. Because ideally, right after you deliver, within 30 minutes, you need to put your baby to breast, and we need to put that baby on your chest to help you bond with that child. It's not the same in cesarean section's case. Okay, you need to be separated from your child for a while for you to be healed before you come back and breastfeed your baby. That leads to delayed bonding and breastfeeding to your baby. There is increased risk of respiratory issues for your baby when you go through cesarean section. Let me explain this point. Okay, so ideally, when you are having a vaginal delivery, when the baby is coming through the birth canal, the chest of your baby is compressed by your pelvic muscles. But in cesarean section, it's not so. The baby was just delivered. The baby didn't go through any stress, was just delivered just like that. Okay. Now, the reason why the baby going through that compression during vaginal delivery is very necessary is because during that compression, there's a fluid that comes out of the lungs of the child which helps the baby to breathe well after delivery. In cesarean section, it's not the same. So your baby starts to have respiratory issues such as asthma, having difficulty in breathing, and all those things. So that is another disadvantage of you having a cesarean section. Your baby will start to have respiratory issues either right after it's born or in the near future. Higher healthcare costs when it comes to cesarean section because you have to pay for a whole lot of things. The gauze you are going to use, sometimes women bleed a lot during cesarean section, so they need to give you blood. You are going to pay for that as well. And even the recovery period, you are going to stay longer in the hospital compared to someone who has had vaginal delivery. Okay, so it costs you a lot when you go through cesarean section compared to someone who has had a natural delivery. There's increased risk of complication during cesarean section, being that sometimes a woman can bleed a lot after cesarean section, okay, or after you deliver, your next delivery is most likely to be cesarean section again. Yes, that is what usually happens in someone who has had a cesarean section. Sometimes people even had 3 cesarean sections consecutively. The first, second, and third pregnancy is all going to be by cesarean section just because the very first pregnancy she went through cesarean section. That is complication of cesarean section. So it increases the risk of complications when you have cesarean section. There are a whole lot of complications when it comes to cesarean section, but these are just a few I've talked about. In my next video, we are going to look at vaginal delivery, what its advantages and disadvantages also are. So, see you in my next video.